This is M mode where the movement of heart, this graphic representation can let you know about the movement of heart. What is that basics? I'm just going to let you know the few basics because we'll be uh, touching everything here today, how to you can play with the keys to get ultrasound image. For that we must be knowing the basics of ultrasound. So piezoelectric effect is the basic basis of ultrasound where specialized crystals are used. If we agitate that crystal with the help of that physical movement, these crystals will produce electricity. In the same manner, if they are agitated with electricity, they will produce ultrasound, and this is called piezoelectric effect. These crystals are arranged in what is an ultrasound transducer. Multiple crystals are arranged here, and they are stimulated with that electrical current, and they produce those sound waves which go into the body and which is more than 20,000 hertz, and they are reflected back at each interface. And due to that reflection, there are gray and black areas in that picture, and we get an ultrasound image. So very important fact that we for diagnostic ultrasound we use from 1 megahertz to 15 megahertz really. Even now people are for corneal ultrasound doing 30 megahertz or 40 megahertz, very high frequencies are being used. But the most commonly in radiology, in medical imaging, peripheral vascular study, we are using 1 to 15 megahertz. And an important fact, the higher the frequency, shorter is the wavelength, and lower the frequency, longer is the wavelength. So the low frequency probes, they have more penetration, and higher frequency probe, they have less penetration. But another fact, the higher the frequency and better picture we get, better is the resolution. So what can we do? So there is a compromise that we use a middle order frequency to have both a good penetration to get to that structure and an acceptable resolution to see that picture. So that's very, very important fact while playing with the keys, fidgeting with the ultrasound probe, that which probe must be used in this patient. So the velocity of ultrasound in body, that is 1540 is an average in the soft tissue. All these are very important fact while doing Doppler and ultrasound. So I told you that lower the frequency, more penetration, higher frequency, less penetration, at the expense of this is the frequency. We'll use low frequency. So not that low to lose the good quality of the picture. And if there is a very thinly patient, we are having that benefit, we can use the higher frequency, can have a very good picture, and it can penetrate enough in that patient. So that's an important factor. A very obese patient comes to you and trying to use the higher frequency, even you can't see it, penetrate the thigh of that patient, a very big thigh. So you have to use sometimes even the curvilinear probe, low frequency probe, if there is obese patient is there. Normally there is a general concept that always use a flat probe, high frequency probe for the limbs, general impression. But sometimes you put the flat probe and you get nothing, you can't even get to the vessel. You can't see the vessel, so much fat is there. So it's very important to know the tricks and the tips how to scan that patient and get a good picture. So there are different knobs, because my topic given to me was novology and how to fidget with that Doppler machine and play with the keys. So there's a knob that is gain, which makes the picture bright and dark. So if your picture is very dark, you will be losing so many structures. It's very bright, everything will be jumbled up and you won't be able to make anything out of the structure, will be mixed up all. So normally, if this is a TGC curve, there is a time gain compensation. The idea is behind time gain compensation is the echoes which are reflected back in the body from the nearest part they get weakened and they are minimally weakened, but which are coming back from the farthest part, they have suffered the maximum weakness, so they should be compensated for that weakness. To compensate that, we always keep our TGC probe, the time gain compensation probe, in such a manner that the echoes coming from the nearest part of the body, they are compensated minimally. But which are coming back from the farthest part, they are get maximum compensation. So people in Lahore, they should get minimum compensation. In the South Punjab, Rajanpur, they should get no compensation. That should be the basic idea. It's happening vice versa. Everything is concentrated. So I'm sorry, I'm not going to the politics. So here again, so the echoes coming back from the nearest part should get minimum compensation. The farthest part should get the highest compensation to get a good image, a good impression. That is very important. Get a good picture. So ultrasound started with A mode and graphic representation. Then with the advent of new technique, new machine, what we do, we send electrical impulses to this transducer having piezoelectric crystals. Electrical energy converted into sound waves, go into the body, come back, go to the machine receiver, then scan converter, and image is seen on the ultrasound machine. And we can save the image in machine's memory or get a printout. That is the whole procedure. How do we get a good image? We started seeing just A mode, first way from obstetrics, only fetal parts, fetal head, and with the advent of now we can do everything from head to toe. We are scanning from everything, peripheral vascular, brain scan. Doppler, the idea of Doppler was evolved by Christian Doppler, a scientist, who said that when a sound wave is received by a person and the sound, the source is moving, like ambulance siren, train siren, the frequency increases. If it's going towards the receiver, the frequency increasing. Is going away from the receiver, the frequency is decreasing. That's the basic idea thrown by that brilliant scientist. So if the going towards the receiver, the frequency is increasing. If no movement, frequency is not changed. If it's going away from the receiver, the frequency is decreasing. You see, it's concentrating, increasing, here it's decreasing. So that's the idea of Doppler. So while this car is going towards the receiver, the frequency is increasing. It's going away, decreasing. That's the basic idea. That's called a positive Doppler shift. If it's moving towards the probe in the ultrasound, I'll come to ultrasound now. If these RBCs, this is the ultrasound probe, these are the RBCs, basically the RBCs which are reflected back, ultrasound beam is reflected back by these RBCs. If the blood is moving towards the probe, that is a positive Doppler shift. Its frequency will increase. So positive Doppler shift. And if it's moving away from the probe, it will be a negative Doppler shift. And in machine setting, it's said that above the baseline positive, below the baseline negative. And again in the machine setting, we have set the machine in such a manner that anything going towards the probe, it appears red. It's not the arterial or venous. It's a misconception that anything coming toward becoming red is arterial. No. Anything coming toward the probe is red, going away from the transducer, that is blue. Anything coming towards the probe is above the baseline, other is below the baseline. That's important factor you have to keep in mind. And then we have CW and PW. CW, where the two separate crystals, they transmit and receive. And here we have less information about the location of the structure, but we can get very, very high frequencies. So in echocardiography, there are very high frequencies. PW, the same crystal is emitting ultrasound and receiving ultrasound. There is a gap between the two. And here we have imitations, we have a picture, location, but we can't measure very high velocities. Very high velocities for you need that CW. So that's a question. I don't want to teach physics, but it's very important to know. This picture is for Doppler because here is written 2F, and 2F means because we are dealing with the reflected beam. The ultrasound beam is coming from the probe to the vessel and coming back to the transducer. It has to travel double the distance. That's why it is having 2. And this cos theta is again, it will come everywhere. You can't leave this cos theta. If you don't understand cos theta, you can't understand Doppler, I tell you. You can't perform, you are not entitled to perform the vascular Doppler because cos theta 90 is 0. The mathematician knows that. We doctors are very bad in mathematics and physics. That's why we became doctors. So, but I tell you one thing, cos theta 90 means 0. So if you try to do Doppler at 90-degree angle, you will get 0 information. Ultrasound picture is best seen if you scan at 90 degree. You get the best picture if you place your probe at 90 degree. But for Doppler, you need less than 90. If anybody is trying to do at 90 degree, no Doppler information. Erroneous information, erroneous diagnosis, as Dr. Yasar were telling you that somebody said DVT and vascular insufficiency, this and that, because the person didn't know the physics. So this picture tells you that if you are placing your probe in this manner, then you will get nothing because it is 0. You have to make an angle with the vessel that we will discuss in image optimization, the next forthcoming slides. So because cos theta 90 is 0. And another thing, that if our angle is less than 60, we can get better picture because error is minimum when it's less than 60. When angle is 62, there is rocketing of error. When error is, you should see here, up to this reflects, up to 60, the error is very low. The moment it goes beyond 60, there is rocketing of error. So you are scanning at 70-degree angle, you get very high error. I am saying velocity is 35, you will say it's 90 because you angle at a different angle. You scan that patient, so angle is very important. I told you cos theta. If you forget cos theta, forget about ultrasound. So I told you that flow is seen at 10, 20, 30, 40, 50, 60, up to 60. It's very good. From 70 to 90, rocketing of error, and at 90 is 0. Very important point. You see here ultrasound beam is striking this vessel at an angle. You are getting highest frequencies. Angle is highest. You see probe is here. These green, yellow colors are reflecting very high frequencies. And here is dead, sufficiently good frequency. The moment we come at 90 degree, no color is seen, so no flow. Power Doppler. Then with the advent of newer techniques, people introduced power Doppler, that it should not be angle dependent. We should get some information where flow is there, present or not, is qualitative. For qualitative analysis, power Doppler is very good. That is not angle dependent. You just want to know the presence or absence of flow. You are not interested to measure or to quantify the velocity. But if you want to have quantitative analysis, you must be having that angle and color Doppler and spectrum. And spectrum is the basis of that. This is the spectrum. Every vessel in the body, from head to toe, has its own specific Doppler signatures. Whether middle name is changed, first name is changed, surname is changed,